Welcome to this deep dive. Today we're talking about bone scans, a really valuable tool, I think, especially if you're thinking about staying healthy as you get older, maybe.
Or perhaps if you're helping support someone, a family member or a friend who's going through medical tests, it comes up.
Exactly. And we're pulling our information from solid sources today, Medline Plus and the HealthWise knowledge base. Reputable stuff.
Definitely.
So our aim here is really to cut through the noise, get to the essential info about bone scans, what they are, how they work, what you might expect.
Yeah, trying to keep it clear, without getting bogged down in overly technical terms.
Yeah.
Useful information for you or someone you care about.
Perfect. So let's dive in. The absolute basics first. What exactly is a bone scan?
Okay, well, simply put, it's an imaging test. Doctors use it to see what's happening inside your bones.
See inside, like looking for specific problem.
Right. It helps diagnose bone diseases, figure out maybe how serious they are. It can spot damage, find cancer that might have spread to the bone.
Spread from somewhere else, you mean?
Yes, exactly. Or it can help find things like infections or even see the effects of, say, an injury or trauma.
And I read something interesting in the sources that it can often find these problems earlier than a standard X-ray. Is that right?
That's a key point, actually. Yes, it can be more sensitive in certain situations. It picks up changes in bone metabolism.
How does it do that? What's the mechanism?
It works using something called a tracer. It sounds a bit sci-fi, but it's basically a very, very small amount of radioactive material.
Radioactive. Okay, we should probably talk about safety later then.
Absolutely, we will.
Yeah.
But it's a tiny amount. This tracer is injected into a vein, usually in your arm.
Okay, so it goes into the bloodstream. Then what?
Well, it travels through your body, and importantly, it gets taken up by your bones. It sort of accumulates there temporarily.
So the bones absorb this tracer material.
Precisely. And as this tracer settles in the bone and naturally decays a little, it gives off a tiny bit of radiation, gamma rays, specifically.
And that's what the span picks up.
Exactly. There's a special camera, often called a gamma camera, that's very sensitive to this specific radiation. It scans over your body.
And creates pictures from that radiation.
Yes. It takes pictures that basically show a map of how much tracer has gathered in different parts of your skeleton.
So areas that take up more tracer look different.
Right. Those areas show up, you could say, brighter or hotter on the scan image.
Right.
It indicates increased bone activity or metabolism in that spot.
Interesting. And you mentioned timing earlier. Does when they take the pictures matter?
It does. It depends on what they're looking for. For instance, if they suspect an infection, sometimes they call it a three-phase or triphasica scan.
3 phases.
Yeah, looking at blood flow, then how it pools, and then delayed bone uptake. So they might take images quite soon after the injection, and then again, say, 3 or 4 hours later.
Okay, and what if they're checking for cancer spread, like metastasis?
For looking at potential metastases, the images are typically taken maybe 3 to 4 hours after the injection. That gives the tracer enough time to properly accumulate in the bone tissue.
Got it. And the scanning process itself, what's that like for the person? How long does it take?
The scan itself usually takes about an hour, give or take.
An hour lying still.
Pretty much. You'll likely be on a table, and this camera will move slowly above and below your body. Sometimes it might rotate around you.
Do you have to change positions?
The technician might ask you to shift slightly a few times, just to get the best possible views, different angles of certain bones. Staying still during each segment is, well, pretty important for clear pictures.
Makes sense. Okay, scan's done. What happens then? Anything you need to do afterwards?
Yes, definitely. Drink extra fluids. Water is great.
Why is that?
It just helps your body flush out any of the tracer material that wasn't absorbed by the bones, helps clear it out of your system a bit faster. Simple step, but helpful.
Good tip. Okay, so that's the procedure in a nutshell. Now, let's think about preparing for it. If you or someone you're caring for has a scan scheduled, what are the practical things to know?
Right, preparation. It's usually fairly straightforward. First off, jewelry, metal objects, take them off, belt buckles, things like that.
Because they interfere with the images?
They can, yeah. Sometimes they might ask you to change into a hospital gown, too.
Okay. And anything crucial to tell the medical team before the scan?
Absolutely. Number one, if there's any chance you could be pregnant, you must tell them. That's really important.
Right, because of the radioactive tracer?
Exactly. Also, it's good to mention if you've recently taken certain medications. Specifically, anything containing bismuth, like Pepto-Bismol, is a common one.
Pepto-Bismol. Why is that?
It can sometimes interfere with how the images look. They usually advise avoiding it for about 4 days beforehand.
Good to know. Anything else?
Just, follow any other specific instructions your own doctor or the imaging department gives you. They might have slightly different protocols.
Always best to follow their specific guidance.
Okay.
Okay. During the scan itself, you mentioned lying still for an hour. Any discomfort, pain?
Well, you'll feel a quick prick from the needle when they inject the tracer, like any injection. But the scan itself? No, it shouldn't be painful at all.
Just the potential awkwardness of staying still.
Yeah, that's the main thing. Lying still for maybe an hour can be a bit tedious or uncomfortable for some people, especially if they already have some pain.
So, what can you do?
Don't hesitate to speak up. Ask the technician. They can often provide a pillow, maybe an extra blanket, something to make you a bit more comfortable. Their goal is to get good images, so they want you to be as still as possible, and being comfortable helps.
Good advice. Okay, we know what it is, how it works, how to prepare. But why do doctors order a bone scan? What are the common reasons the real world uses?
Oh, there are quite a few important reasons. One big one is diagnosing bone tumors, checking if they're cancerous or benign.
Finding tumors in the bone itself.
Right. And also, very commonly, checking if cancer that started somewhere else, like breast, lung, prostate, thyroid, kidney cancers, are common ones that can spread.
Checking if it's spread to the bones.
Exactly. Checking for metastasis. Detecting that early is often really crucial for planning treatment, especially for older individuals where managing symptoms and quality of life is paramount. Sometimes it picks things up even before there's significant pain.
That really underlines its value. What else?
Well, it's also great for finding fractures that are hard to see on a regular X-ray.
Like what kind of fractures?
Things like certain hip fractures, especially in older people, or stress fractures, maybe in the feet or legs. You hear about athletes getting those, but anyone can. Even some types of spine fractures.
So subtle breaks X-rays might miss?
Correct. Bone infections too, osteomyelitis it's called. A bone scan can be very helpful in finding those.
Okay. Any other major uses?
Yeah, if someone has bone pain but the cause isn't clear, a bone scan can sometimes help pinpoint the source. And finally, it's used to evaluate certain metabolic bone conditions, things like osteomalacia, which is like soft bones, primary hyperparathyroidism, sometimes osteoporosis, though other tests are usually primary for that. Also, conditions like complex regional pain syndrome and Paget's disease of the bone.
Wow, okay, that's a surprisingly wide range of uses. So once the scan is done, the images are ready. How do doctors interpret them? I think I've heard people talk about hot spots or cold spots.
That's right. So in a normal scan, the tracers should look pretty evenly spread out through all the bones. Nice uniform uptake.
And abnormal is when it's not uniform.
Essentially, yes.
Yeah.
Abnormal results usually show up as areas where the tracer uptake is different. Either increased uptake, those are the hot spots, or decreased uptake, which are called cold spots.
So what does a hot spot mean? More tracer uptake.
It means there's more metabolic activity happening in that bit of bone. It's working harder, you could say.
And what causes that increased activity?
It could be several things. Arthritis often shows up as hot spots. A healing fracture will be hot because the bone is repairing itself. Bone tumors, both cancerous and benign, can be hot. And infections, osteomyelitis, are typically hot spots too.
So hotspot doesn't automatically mean cancer.
Absolutely not. That's a really important point. It just means there's increased activity. More tests or context is usually needed to figure out the why.
Okay. And the opposite, cold spots. Less tracer.
Yeah. Cold spots are areas where less tracer than expected has accumulated. This might suggest a problem with the blood supply to that area of bone. Perhaps it's been disrupted.
Lack of blood supply.
Or sometimes certain types of cancer can actually present as cold spots, maybe because they're destroying the normal bone structure and interfering with tracer uptake.
Right. So again, it's not a diagnosis in itself.
Definitely not. It's crucial to remember the bone scan findings are always interpreted alongside everything else. Your medical history, symptoms, physical exam, other imaging like x-rays, CTs, MRIs. It's one piece of the puzzle.
Your doctor puts it all together.
Exactly. And they'll discuss any abnormal findings with you and explain what they likely mean in your specific case.
That makes sense. Now, back to something we touched on earlier, safety. People hear radioactive and understandably get concerned. What are the actual risks here?
It's a very valid concern. But the amount of radioactive tracer used is really, really small. Most of it leaves your body naturally within a day or two.
How does the radiation dose compare to, say, an X-ray?
It's generally considered comparable. The risk is thought to be likely not any greater than having routine X-rays. Very low level.
Are there other risks besides the radiation, like from the tracer itself?
It's rare, but possible. Some people might have a mild allergic reaction to the tracer, maybe a rash or some swelling. It's uncommon, though.
And the injection itself?
Well, like anytime a needle breaks the skin, there's a tiny, tiny risk of infection or a bit of bleeding or bruising right at the injection site. But again, very minimal.
Okay, now I remember the sources mentioned something specific for people who are breastfeeding.
Yes, that's an important precaution. If you are breastfeeding, the standard advice is to pump and discard your breast milk for about 1 to 2 days after the scan.
Pump and dump, essentially.
Right. Use stored milk or formula during that time instead. It's just to ensure none of the tracer passes to the baby.
Makes sense. Any other general precautions after the scan?
Just the advice about drinking flu, as we mentioned. And it's generally recommended to flush the toilet right after you use it for a day or two and wash your hands really well with soap and water each time.
Just helps minimize any tiny exposure to others.
Exactly. Standard radiation safety practice, even at these low levels.
Okay, practical tips. Finally, let's just recap the timeline and any aftercare.
Sure. So after the injection, there's that waiting period, typically 1 to 3 hours.
Time for the tracer to circulate. Bring a book.
Definitely bring something to do. Then the scan itself takes around 1 hour.
And getting the results, how long does that usually take?
Usually your doctor should have the report within about 2 days, sometimes sooner.
And aftercare. Anything needed once you leave.
Not usually much. If the spot where you got the injection feels a bit sore or swollen, which can happen sometimes,
Yeah.
just applying a moist, warm compress to the area can help soothe it.
Pretty simple then.
Generally, yes.
Okay, so wrapping up, it really sounds like a bone scan, despite the radioactive part, which needs understanding, is a powerful tool. It gives doctors a unique look at bone activity.
It really does. Helping find problems early, guiding treatment, checking on healing. It plays a valuable role in understanding bone health, especially as we age or manage chronic conditions.
And for anyone listening who might have a bone scan coming up or is maybe supporting someone through it,
The best advice is always talk to your doctor or the healthcare team. Ask questions. Share any concerns you have. They can give you personalized information.
absolutely. Open communication is key.
Yeah.
You know, thinking about how this scan uses the body's own uptake process to signal changes, it makes you wonder, doesn't it? Just what other subtle signals might our bodies be sending us all the time about our bones or other aspects of health that maybe we're not always tuned into? Something to ponder.
That's a fascinating thought. Definitely food for thought.
Well, thank you for walking us through all that. Really helpful information.
My pleasure. Glad we could shed some light on it.